Okay, this video is like part 3 of Cancer from the book Dr Mcdougall, The Doctor Who Fought for You by me, Pete Rogers. Okay, so Dr. Mcdougall says there's 2 ways you can meet a doctor. Number 1, you can go to the doctor's office because you have a question or you're sick. Number 2, the doctor comes looking for you. This is the business of screening, trying to find early disease. Disease mongering is turning people into patients for profit. Screening is one of the most profitable ways to gather up the largest number of customers. This is disease mongering. And I'll tell you, my metaphor for this is, imagine you're walking in the shopping mall and there's men standing on the roofs and they throw a net on you. That's what screening really is, okay? Taking people who are otherwise healthy and trying to find a disease in them. And what the public doesn't realize is that for every person who has a disease, there's like 100 that have variations, normal variation, and they end up getting stuck having to go for follow-ups. The old joke in radiology is, what's the definition of a healthy person? Somebody who hasn't had a body CT yet. Body CT means chest, abdomen, and pelvis, because there's almost always a bunch of false positives. In the lung, there's almost always peripheral subpleural micronodules that need follow-up to exclude cancer, but they're never cancer. Okay, in the abdomen, there's almost always a potentially atypical kidney cyst, liver cyst, adrenal nodule, pancreatic cyst, sclerotic bone lesion, that all end up getting worked up. So even if they tell you, oh, the first one's free, you might be stuck, getting 5 more scans, and it could cost you a lot of money. Plus, it makes you nervous. You're all worried. Oh, do I have cancer or don't I? So you got to go for all these follow-up tests, and then you go for the kidney cyst, and it has a thin septation, a Bosniak 2F, likely benign, but just to be safe, let's follow it up. That can go on for 2 years, even 5 years. Okay, so screening is much more dangerous than people think it is. I've been involved in it for like 30 years, and I can tell you, I would never do it. Okay, Dr. Mcdougall continues. If the doctor is going to go around to healthy people and tell them that they should have a medical test, that the test should have a really good research data to support, then the test should have really good research data to support it. Evidence that people are truly better off for having had the screening test. Monger is a derogatory term for a dealer. Disease mongering is the selling of sickness that widens the boundaries of illness and grows the markets for those who sell and deliver treatments. It is exemplified most explicitly by many pharmaceutical industry-funded disease awareness campaigns. Okay, and I would also agree with that. Watch out for the word awareness. They're going to say breast cancer awareness or prostate cancer awareness, and they just want you to screen. Notice they never say patient empowerment. We're going to empower you to reduce your risk of breast cancer by learning about estrogen chemistry. You'll never in your entire life hear that. Doctors don't even know that. I always ask when I get residents or medical students following me around, I always ask them all these questions. They never know anything, except one resident knew a little bit about estrogen because she was going into OB-GYN, or maybe her parent was an estrogen OB-GYN doc, but they don't know. Okay, let's see. Disease mongering turns healthy people into patients. So-called improved survival from screening is usually due to lead time bias, meaning that if you have control conditions and one patient develops symptoms from a cancer when they're 79 years old and then dies when they're 80 years old, that's a 1-year survival. But if the same patient had been diagnosed at 70 but still died at 80, then they survived their cancer for 10 years. But that doesn't mean the screening changed anything. It just means there's a lead length bias because it was diagnosed earlier because of the screening study. And what I'm trying to say is, Dr. Mcdougall here says it, screening assumes that the workup and treatment of cancer will be beneficial. This is not always the case. Workups and treatment often have a lot of side effects. Besides being expensive, treatments often do not work, but they do cause side effects. Many early cancers are detected that never would have become symptomatic, and it would have been better off to not know about them. If you get overdiagnosed with cancer that doesn't need to be diagnosed, you can be overtreated with chemo too, okay? All right, now he talks about Peter Gochke. Let me make sure we got this in the right spot here. Well, first I'll move it when I get to that point. Peter Gochke from the Cochrane Collaboration is the world expert on the effectiveness of mammograms. He wrote a book called Mammography Screening, Truth, Lies, and Controversy. Gochke says that routine mammograms, number 1, do not save lives, and number 2, they increase the number of women who are overdiagnosed. whose tumor would not have caused symptoms, and thus they would have been better off not knowing about it. And number 3, it increases the number of women who will get a mastectomy, and probably unnecessary mastectomy. Other pioneers who helped show that mammography is not beneficial include Charles Wright and Barbara Mueller. In general, if 2,000 women are screened regularly with mammography for 10 years, then one woman will benefit and she will avoid dying from breast cancer. So that's 1 out of 2,000. That's not much. 1 out of 100 would be 1%. 1 out of 1,000 would be 0.1%. Okay? So this is like 0.05%. That's not much. Okay, however, 10 healthy women, that's 10 of them, will be diagnosed unnecessarily with breast cancer. And they are at risk for significant side effects from treatment. They could have a chemo side effect and die. Furthermore, about 200 women will experience a false alarm. So they're going to be all worried and stressed out, and that can give them other problems. It therefore no longer seems reasonable to attend to breast cancer screening, was the conclusion of the Cochrane collaboration on screening mammography in 2013. Okay, yeah, so I remember that mammography, it was one of my least favorite things to be around. All these women are hysterical. They take this mammogram so seriously, and then when it's interpreted, very often it's hard to tell what's going on, and they get all these follow-ups or special views. I'm not impressed by it. So anyways, I hope that was helpful. That's it for this version of Cancer, Dr. McDougall.